This week, we visited an abortion clinic here in New York to learn how providers are preparing for the possibility of losing access to America's most used abortion medication.
We're trying to think ahead.
This Public Health Solutions clinic in Brooklyn has seen an influx of patients seeking abortion care since the overturn of Roe v. Wade last year.
We've seen between 2 and 3 times the volume of women needing a medication abortion over the past year than we had seen before.
And after Texas Judge Matthew Kacsmarik's ruling repealing mifepristone's FDA approval, confusion abounds.
I think that's the whole point of the anti-abortion movement, is to confuse people so that they can't or won't get the care that they need. Even, people here in New York, unclear if abortion is still legal. People in states where banned calling clinics and not realizing that abortion is not legal in their states. So there's a lot of confusion, and not just among patients, but even among other physicians. We're in a whole new legal landscape that hasn't been tested in this way before.
Right now, the 2-drug protocol, mifepristone followed by misoprostol, is considered the gold standard of care. While it's possible to perform medication abortions using only misoprostol, providers say it's not ideal. If mifepristone is banned nationally, you can still offer medication abortion with misoprostol alone. What's the but?
It can cause side effects to last a little bit longer, so people have to take more doses of the misoprostol than when you use it with a combination of mifepristone. But it is safe and effective. If we don't need to use that regimen and we can stick with the mifepristone, that's what we would prefer to do.
These drugs are also vital for other medical procedures.
Mifepristone and misoprostol, those medications are the exact same protocol and exact same medications used in abortion and miscarriage management. It's just very difficult to explain to a patient why we can't use a certain medication or provide them with certain care because a law is in the way, not because it is unsafe.
With abortion rights under attack across the country, clinics like PHS know that a legal challenge hundreds of miles away can impact them, even in an abortion safe haven like New York.
The real issue is many more women coming to New York for care, and that creates backups in the larger, better-known facilities. The fact remains that it's not just New York. If abortion is not safe and accessible in the whole country, it's not really safe in New York either.
With additional court rulings in the pipeline, clinics like PHS are preparing for the worst.
Here's our medication.
Okay. I will admit to you, when I heard stockpile, I imagined a little bit more than this. Do you feel you have what you need?
For now we do, but we are going to be ordering more because we are concerned about, what it's going to look like in terms of the supply chain and what would happen if we're only relying on misoprostol. Then we need to have more of that. So we want to make sure that we do think about the future and, get more than what we think we need today.